Hello and welcome to Medicine with Dr. Morin. I'm Dr. Keith Morin. I have been asked a number of questions about the odds of dying with coronavirus video that I made and how this changes with different patient age groups. My patients have asked specific questions about their odds at their age with their specific medical problems. We do have new evidence from a recent meta-analysis. This was published recently. The link to this paper is down below in the description. This was a meta-analysis looking at age-specific infection fatality rates derived from 3 large recent antibody studies. These antibody studies give us a good idea of all the coronavirus infections, not just the people that have presented and have had a positive nasopharyngeal swab. To review, the infection fatality rate is the percentage of people who die of all people who develop infection with coronavirus. This is the statistic that my patients really want to know. This, of course, is significantly less than the case fatality rate, which is the percentage of people who die out of all the cases that come to medical attention. These two important things are defined on this slide for you. With this illness, the case fatality rate is typically about 5 to 10 times higher than what the infection fatality rate is. As an introduction, this slide shows the COVID-19 cases in New York City. Out of 8 million residents, antibody studies showed that the estimated number of infections was 1.6 million, of which 1.1 were symptomatic. There were 220,000 reported cases, which led to 55,000 hospitalizations and 23,000 deaths. So you can see that the reported cases were 12% of all infections, and fatalities were only 1% of all infections. The authors in this study took a look at all studies that they could see, about 50 different ones in total, but a number of studies were excluded because a large number were not suitable for estimating an age-specific infection fatality rate. Others did not have a good representative sample of the general population. They used 6 studies as their benchmark. This slide shows the location of the 6 recent large-scale antibody studies. They were done in Geneva, Switzerland, Belgium, Indiana, New York, Spain, as well as Sweden. This slide shows the estimated infection fatality rates, which I will refer to as the IFR, for the different age groups based on these 6 studies. As you can see, the IFR is close to 0 for younger adults, but rises to 0.3% for ages 50 to 59, 1.3% for ages 60 to 69, 4.6% for ages 70 to 79, and 25% for people who were 80 or above. They then went on to compare this particular graph to the antibody studies of 9 other US geographical regions. I covered these 9 particular regions in my video, Odds of Dying from Coronavirus, an Update. Here is the graph for those additional studies. You can see that the vast majority of the data is within the prediction intervals. In addition, they compared it to data for 3 countries and 3 small-scale locations that had engaged in comprehensive tracking and tracing of COVID-19 infections. The 3 countries were New Zealand, South Korea, and Iceland. They also included data from Castiglione in Italy, the Diamond Princess cruise ship, as well as the town of Gangelt in Germany. On this slide, you can see again that the data is within the prediction interval, with the exception of the data from Castiglione in Italy, which was affected early on and severely, and their medical resources unfortunately were overwhelmed, leading to rationing of healthcare and thus slightly higher death rates than would normally have been seen. They went on to take these age-specific IFR numbers and to compare it against accidental injuries. This chart shows that if you're in the 55 to 64 age group, your IFR is 0.7%, meaning if you catch the virus, the chance of dying in that age group is 0.7%. But if you look at your yearly automobile accident fatality rate being 0.01%, that's much lower. So the likelihood of dying from COVID-19 is 50 times higher than the annual fatality risk of driving an automobile. In addition, the antibody study data indicates by the last week in June, 20 million Americans have become infected, which is 6.4% of the US population. Based on IFR rates at different ages, they then went on to pose 3 different scenarios, which are outlined on this slide. The 3 scenarios assume that the infection rate continues rising to a plateau of around 20%, which was what was seen in New York City. The first scenario assumes that the frequency of infections in each age group will remain similar to the pattern so far. Scenario 2 looks at a situation where disease occurs in equal fashion across age groups. Scenario 3 is if there's significant protection of the vulnerable age groups, which is the elderly. Based on this, they can predict the total number of deaths as you see on the slide. It's of course difficult to know whether the virus will truly plateau around 20%. There have not been any good studies looking at the role of comorbidities or demographic or socioeconomic factors to give IFR rates by age. These will of course be done. Often I will get asked the question, what is the likelihood of dying with the virus if I'm in my 50s and have diabetes, or if I'm in my 70s and have obesity and high blood pressure? There's no question based on a recent UK study in hospitalized patients that mortality rates are strongly linked to things such as diabetes, obesity, and chronic lung disease. In this UK study, there is no question that patient age was the most important risk factor and much more important than any other specific comorbidity in determining whether you're going to die or not. The UK study showed that an obese 40-year-old patient in the hospital was at a slightly higher mortality rate than a non-obese individual of the same age. But that 40-year-old patient who was obese had only a 1 in 10 chance, the death risk for a non-obese 75-year-old patient. So this is the most important thing, is that age seems to be the biggest risk factor by far. Thank you for joining me today on Medicine with Dr. Morin. I'm Dr. Keith Morin. Get healthy and stay healthy.